When the massage therapist moves the body in the various types of joint movement, we are using range of motion methods. Being demonstrated are various ways that you would move the body during a massage segment. To really understand and apply range of motion techniques correctly, you need to understand the action and movement of the joints, the normal range of motion at each joint, and the tissue elements around it. Range of motion can be passive, active assisted, active resisted, or the client can do the motions themselves, which would be active range of motion. Range of motion can be applied in all three positions. Currently, you're seeing some methods applied in the prone position. All joints of the body should be moved during the course of the massage as appropriate. This becomes an active part of the assessment process. It also can become a treatment process, and then it would become a post-assessment process. The remainder of this demonstration sequence is going to show range of motion applications to various parts of the body and in various positions: prone, supine, sideline, and seated. Range of motion methods are also able to be applied while the client is in a side-lying position. The knee joint can be effectively moved, as can the hip joint. The arm is able to be moved, and these various positions can also be starting points for muscle energy techniques. The side-lying position is actually the most effective positioning for range of motion of the shoulder area. This position also allows for range of motion of the vertebral column. Range of motion methods in the side-lying position can access almost all areas of the body. Often, most range of motion methods are applied when the client is in the supine position. And while this is an effective positioning method, it is often advantageous to use prone, side-lying, or seated position. By placing the arm up over the head, the scapula can be mobilized as well. A range of motion application that's often ignored is the internal and external rotation of the knee joint. This is an effective position to do this. You will notice the movement by the tibial tuberosity. Joint movements can be done in a sequence. In this demonstration, you're seeing that many movements are being assessed and moved at the same time. The seated position is often forgotten in terms of range of motion application. The following examples provide ways that you can use the seated position effectively for range of motion techniques. The seated position is an effective way to use range of motion methods for the lower limb as well. Another area for range of motion that is often forgotten is to make sure that the patella moves easily. The seated position is effective, as is the supine position.